Problems with sleep affect over 70 million Americans. Research shows that sleep disturbances may cause heart disease, ADD/ADHD, chronic fatigue, headaches, and more. Sleep disorder specialist Dr. Jerald H. Simmons talks with Heartbeat of America's William Shatner and Doug Llewellyn in an effort to inform the public on how sleep disorders can affect one's health. The following is a rebroadcast of a nationally televised interview that aired on August 4th, 2008.
Welcome. Good to have you with us. All right, let's begin by telling me what you do and who benefits from it.
I'm a neurologist and a sleep disorder specialist, and I treat people that have difficulty with their sleep and it affects their daytime functioning. So I help people so they can live a better, more healthy, productive life.
Well, you're obviously successful, so what do you attribute your success to? Any particular philosophies or strategies?
My concern for patients is really what has brought me to do real well. I will keep on fine-tuning a patient's situation until I can finally get it to where they're going to be doing well, sleeping well, and feeling more productive during the day.
Now, stay with us. There's more to come.
Thank you, William. I'm Doug Llewellyn, now here in our studio in Los Angeles with our guest. His name is Dr. Jerald Simmons. He is a physician practicing in Houston, Texas. To be more specific, he is a triple board-certified neurologist, and he is a specialist in treating sleep disorders, which is an extraordinary subject, as you're about to hear. You may have seen this doctor. He's been interviewed by Tom Brokaw on NBC News. He is highly recognizable in the Houston area. And, Doctor, it's a pleasure to have you with us.
Thank you very much.
Listen, sleep is such an unbelievable subject to talk about because a lot of people are walking around all the time suffering from not enough, right?
Correct.
And a lot of them don't know why. Let me ask you, what are the most common sleep disorders that people have?
Well, problems that will result in daytime sleepiness and fatigue, such as sleep apnea, such as restless leg syndrome. There could be leg kicking movements during the night. There can be abnormal behaviors during the night. We call these parasomnias, sleepwalking, sleep talking, and those constitute common sleep problems that we see in our society.
A number of Dr. Simmons' patients are standing by for us to get some information from them. We'll be hearing from them periodically throughout this show. Let's take through the list. Let's go through the list and talk about some of these in more detail because I'm sure our viewers, this will connect with some of them. They say, hey, that might be me. And they don't even know it yet. First off, what about daytime fatigue and just in general sleeplessness? They're not getting enough good sleep at night. Is there a general cause for that?
No, there's several different causes, but let's talk about one of the most common ones, which relate to snoring and sleep apnea.
Okay.
Snoring is a real big problem.
Yeah, can ruin a marriage.
Exactly. But snoring is really a piece of a larger picture, okay? Really to understand snoring, we really have to look at what goes on with breathing. So when a person breathes, air rushes through the back of your throat. As air flows through the back of your throat, it creates a negative pressure. That's called the Bernoulli effect. Whenever you have any kind of flow going through any kind of space, you're going to get this Bernoulli effect. And an example that you can relate to would be a shower. You know when you turn the shower on and the water flows, you know how the curtain sometimes pulls in towards the water? That's because there's a vacuum being created, this Bernoulli effect, from the flowing water. One of the principles of the Bernoulli effect is if you have the same amount of flow going through a smaller space, you get a stronger vacuum. Same amount of flow through a larger space, there's less of a vacuum. That's why if you push the curtain further away from the water, it stops pulling in. Those same principles apply in your throat. So imagine this being the back of your throat. Imagine this being your tongue. Your tongue starts right here, goes to the back of your throat, and goes forward. So this is your tongue in the back, starting in the back of your chin, goes to the back of your throat, and goes forward. So when you breathe, air rushes through this space. As air flows through this space, you get that vacuum. When you fall asleep, the muscles relax, your airway becomes more narrow, so there's a stronger vacuum. All right? That's true for everybody, but typically that increase is so small that it's negligible. But in some people, the airway becomes more narrow, and there's a stronger vacuum. At a certain point, the vacuum's strong enough that it pulls in the tissue, making it vibrate, and that vibration is snoring. At a certain point, the negative pressure is so strong that the airway will completely collapse. At that point, a person's asleep, they're trying to breathe, but they can't. So there's a brief awakening. With the awakening, the airway opens up and breathing starts up again. And that's obstructive sleep apnea. That brief awakening lasts 2 or 3 seconds. The person's not even really conscious of it.
Yeah, they don't know.
They have no idea.
Right.
They go right back to sleep, the muscles relax, and the whole cycle starts over again. So that happens repetitively through the night, resulting in someone getting non-restorative sleep, and they're going to be sleepy and fatigued the next day.
They've been in bed 8 hours, but maybe they've only slept, what, 4?
Well, it may be the equivalent of, yeah.
The equivalent of that? All right, so that's a major problem. What do you do to treat that?
Well, you can treat that by administering positive pressure, because positive pressure will get rid of that negative pressure, and it nullifies that Bernoulli effect. And that's one of the treatments. That's called CPAP. CPAP stands for continuous positive airway pressure. So by administering this positive pressure through a mask over the nose, you can, as long as the machine is adjusted to the right level, you can then get rid of that negative pressure, stop the snoring, and prevent the airway from collapsing during the night.
We have Dr. Rafael Correa Coronas with us. Dr. Coronas is a retired physician who was diagnosed with obstructive sleep apnea. Doctor, tell me about the problems you were having before you were diagnosed.
Well, mainly my problems had been with feeling drowsy during the daytime, falling asleep easily if I was in a quiet place, and also dozing off completely in the middle of the morning when I was driving back home from a trip to Oklahoma. That is what led me to be referred to Dr. Simmons.
I am sure dozing off behind the wheel can be an unbelievably frightening experience. Explain to me how using the CPAP machine has helped you.
Well, for me, it was a miracle, because no sooner did I learn how to use my CPAP properly and keep the mask on night after night after night, no longer did I feel sleepy or drowsy during the daytime, and I was back to my old self.
This is a CPAP mask. Now, some people have the misconception that the mask has to be strapped down really tight. That's not true. This mask, for example, inflates when the pressure is being administered. So there's almost like a shock absorber. So it can be gently placed on the person's nose, and then the pressure inflates this, and it can stay on during the night. This particular mask is sophisticated because as there's movement, the mask maintains the proper seal by maintaining its position over the nose. So this is one example, and there's a lot of adjustability here.
Now, there are a lot of masks. Let me hold this one up. This is one that, obviously, this is designed. Does this go in the nose?
Yeah, it goes right into the nostrils.
This goes into the nostril. Obviously, this hose is connected to the CPAP machine. There's another hose that goes and connects it. So this just goes in the nose. Is this fairly comfortable, or does this bother people?
For some people, yes. Some people, no. The one thing about mask technology, there's no one CPAP mask that works well for everybody.
All right.
So by having a variety, it's important for the physician treating a patient to follow up with the patient, have the patient bring their machine and their mask, and if a patient's not doing well, they need to switch sometimes to a different mask, one that's going to be more comfortable. So a mask like this, for some patients, it works really well.
Now here's one. This is really intriguing. This looks like it also goes in the mouth as well. Am I right? You're getting a good shot of it.
And we talked earlier about the jaw, and as you fall asleep, the jaw goes back, so the tongue goes back. So there's a dental appliance, which we really haven't touched on yet. Dental appliances are also viable treatments for treating people that have obstructive sleep apnea, because the dental appliance can bring the jaw forward. Now that particular mask is a combination of a dental appliance with a CPAP mask. So that jaw, the person's jaw can be brought forward, and they can have the CPAP mask to administer pressure, and the combination will treat them. And that particular mask does not require a strap.
Let's go to another subject, insomnia. What about that? How do you treat that?
Well, insomnia is really broken up into different kinds. There's people that have difficulty falling asleep, and then if people have difficulty staying asleep. So some people that have difficulty going to sleep, it could be for psychological reasons. They may be stressed, but they may have another common problem called the restless leg syndrome. Restless leg syndrome affects probably about 10% of the population. Not to say that 10% of the population will require treatment, because it may not be a nightly problem, but it may be more like 4% of the population may have restless legs to a degree that needs to be treated.
And does that wake you up?
Well, there are leg movements that can occur in the middle of the night in people that have restless legs, and these leg twitching movements can wake you up.
Right.
And they also result in you having non-restorative sleep. It can result in daytime sleepiness.
So what do you do for that?
There's certain medications that we can use, and now we now realize that this is a problem with dopamine, actually. There's dopamine functions almost like a filter within part of the nervous system, and by not having enough of this dopamine, there's signals that get through that it's almost like a static of the nervous system, and it creates a sensation of restlessness. So a person moves their extremities, particularly the legs, to drown out the static. So the stimulation of movement drowns out this restless sensation. By increasing dopamine, we increase the strength of that filter, and we're filtering out the static sensation. So dopamine actually works well. But you can also have this problem as a result of an iron deficiency. And so we see it a lot of times in people with anemia. We now know that you need iron for your brain to make dopamine. So we measure iron levels in people that have this problem. But this is a common problem for people that have insomnia, and we now understand it better and we can treat it better.
Very interesting. Another big problem, you define this, ADD and ADHD.
Okay.